Hi, welcome to our webinar. If you have shoulder pain, this is the one thing you need to know and why your doctor, man, just won't tell you about it and why that is. So my name is Dr. Jeff Donatello. I'm the clinic director at the Center for Wellbeing here in Portsmouth, New Hampshire, and we do different types of regenerative biologic therapies to help you regenerate, rejuvenate, and restore tissue. And in this case, we're going to be talking about the shoulder and the pain that you may have. We've had over 2,000 patients come in our office for these therapies over the last 3 years. We lead New England in doing these therapies, and I talk to everybody. And when people have shoulder pain, the first thing they talk about is that they have what we call top shelf issues. They're not working with anything, let's say, it's above their shoulders, which is a whole world that they can't reach anymore. This time of year, many people are gardening. You can't work out maybe like you used to if you have shoulder pain, which creates weight gain, which makes you tired and fatigued, and you don't sleep as well. And I talk to people all day long with these problems. You don't have to suffer, and it makes you feel miserable. It creates a bad attitude, and pain is not fun to be around. And it's just one of those things that really can put you in a bad situation. So what it comes down to is the one thing: why you're still in pain, why are you still in this situation, is you've probably not tried, more than likely, a regenerative therapy. So we're going to talk about what that is, because everything we do is aimed at building, growing, creating, repairing your own new tissue. Now, to be clear, we're not going to give you an 18-year-old shoulder again, but 90% of our patients that have shoulder techniques done in our office with the regenerative biologics 1 year later are 60 to 80% better. And for many situations, they're 100% better. But again, it depends on you as an individual. So what we're going to talk about in the next probably 6-7 minutes, this isn't a long webinar, is stem cell derived biologics, PRP, and prolozone. I know your time's valuable. We're in a really tough time now. We're under quarantine, and that can a lot of times make your pain worse because you're just not doing much. So this is a time to really learn and maybe take some action. So one of the questions I always get from patients after they've gotten better, they become really frustrated, and they've suffered for years. They didn't have to, and the question is, why has your doctor not told you about these therapies? What is going on? Well, most people, their doctor went into this profession to help people heal, but they get in and they realize that most of their education comes from drug companies. So on their right shoulder, they have the drug companies. The left shoulder, they have insurance companies. These therapies aren't covered by insurance, so it's outside of their scope. They're working 80 hours a week, 40 patients a day, trying to keep their head above the water, and all they have to offer you are therapies that are non-regenerative. So they're kind of stuck in the past. Now, here's the thing. Many of you, the first place they're going to go, well, first place is NSAIDs, right? Non-steroidal anti-inflammatories, Advil, Motrin, and hopefully that helps. It can cause definite stomach ulcers, so you have to watch out for that if you're taking multiple pills a day. But cortisone, right? We all hear, well, we got to get a cortisone shot. And I'm not anti-cortisone. I'm anti-multiple cortisones. So if you get one shot and it works, great. But when you have 2, 3, 4, 5, and it's not working, or it's working less and less, what you're doing is you're destroying the cartilage in that joint, and it can create a problem. Cortisone is caustic, and it's an adjective, right? If you go in the dictionary, it's the ability to burn, corrode, or corrode organic tissue by chemical action. So when you put a chemical in there, there's going to be negative side effects. It's super, super anti-inflammatory, but it erodes cartilage. It causes degeneration. It causes, over time, your body starts to deteriorate physically or not mentally in this case, but it deteriorates, and it causes osteoarthritis. I still get people in my office that don't realize that multiple cortisone shots really are setting you up for replacement surgery or some type of surgery, because arthritis is going to get worse and worse. Now, with the regenerative biologics that we put in you, they target arthritic conditions. Many of our patients are bone on bone, so we look for degenerative change. That's what we really want to work with. So sometimes you'll have, maybe they'll scope your shoulder, an arthroscopic surgery, which works really, really well if you're younger and you tear, let's say you tear a cartilage in there, or your labrum is torn, some of that liner on that ball and socket joint are torn, or your AC joint. It's great. But when you have articular cartilage issues when you're older, you can't go in and clean out that shoulder and expect to get really good results. Now, this is the knee, but the American Academy of Orthopedic Surgeons stated last year after looking at a study, there was 13 trials they looked at, and 1,600 patients, they said that they were confident that arthroscopic surgery does not on average result in improvement in long-term pain or function. Again, that's for the knee, but you can't think that when you're older with arthritis that you're going to go in and, quote, clean up the shoulder. It sounds great. It sounds like you're raking the leaves off the lawn in spring cleanup. It doesn't work like that. You can't go in and just clean it up. Maybe for small things, if they're really good, and they'll nip things out, but usually if you have degenerative change, look, think of it as a rusty bumper. It's really tough to make a rusty bumper a new bumper from surgery, okay? And now, regardless of whether it works or not, the risk, my biggest problem is if they have to put you under, anesthesia is not healthy for your brain. This came from the Mayo Clinic last year. They looked at this study and they said in adults over 70, this is almost 2,000 people they looked at. They had, after going through general anesthesia, they had a subtle decline in memory and thinking skills. So they had an elevated risk for dementia and Alzheimer's disease. So we don't want to have to diminish brain function in order to fix a shoulder. And it's crazy when there's all these things that can help you regenerate, grow, repair, create new tissue. So let's talk about some of these therapies. PRP, prolozone, and some of the stem cell derived amniosomes from an allogeneic source. So prolozone, Dr. Schellenberger, maybe you've studied this. If you look it up online, prolozone's been around for a long, long time. Our nurse practitioner has done thousands and thousands of injections with prolozone. It's taking oxygen from a tank and putting it through a machine that concentrates it and adds another molecule of oxygen onto it, which makes it ozone, which is that smell you smell after a lightning storm. Ozone is very antiseptic. It is extremely effective at increasing the oxygenation in that joint and making that joint healthy. So we can do prolozone for many, we do it a lot with shoulders, many conditions. A lot of times we'll use it in conjunction with PRP. So platelet-rich plasma, that's taking your own blood. We have a medical assistant that's used to work for the Red Cross. She's awesome. She draws blood like a pro, and we put it in a centrifuge and we spin it up for about 8 minutes, and the growth factors and the platelets that come out of that are then injected back in you. This works really good in combination with our regenerative biologics. It also works really good if you're by itself. If you're under the age of 50, when you get to be 50, 60, 70, don't do this. It's a waste of time for the most part. The reason is, what PRP does, when we put the growth factors and platelets back in you, what it's doing, it's helping you heal by stimulating your own stem cell activity to secrete exosomes. And the exosomes we'll talk about next time. In this case, amniosomes, what we can actually, that's what does the healing. So in short, the older you are, the less PRP works. So keep that in mind. So really, what we're famous for, we have people that fly in from all over the country. And again, we've done 2,000 of these procedures, is mesenchymal or mesenchymal stem cell biologics. These regenerative biologics, they come from the most powerful healing tissue that we have. It's where life began. They're from an allogeneic source or a donor source. All our labs are FDA certified. It comes from a healthy baby, healthy mom, C-section delivery, rigorously tested the same way our blood supply is tested. And it's a super healthy way to get tissue to regenerate and restore healing. It's the most powerful anti-inflammatory thing we have. I just talked to a man, 82 years old, that had his knees done, and he went and walked on Rye Beach afterwards. And literally right before I did this, I talked to him on the phone, and he said that he walked the beach and he had like literally no pain. And he hobbled in our office. And it doesn't work like that with everybody, but a good 20 to 40% of people with shoulder and knee pain or hip pain, low back, necks, they notice change very quickly because it reduces the inflammation fast. Then it regenerates tissue over time. This process can take upwards of 6 months, and it does that by regulating your immune system to help your healing time really speed up. There's no potential for adverse or allergic reaction. We've had, again, getting back to thousands of patients, we've had 0 issues with people that have been hurt by this. It's an extremely safe way of doing it. And the blood types do not need to match. It's not a blood product. So one question people have is, how long does the therapy take? They want to know kind of what's going on. We have almost a concierge practice where, in this day and age of, the coronavirus, COVID-19 and quarantine, we have an office where people come in one at a time. It's not like a crowded office where people are sick. You're in the office for about an hour, and then you're out the door. And it will take, it's like I mentioned, results can be very quick. but most people notice change in the first 3 to 4 weeks. So the cost, again, it's not covered by insurance per shoulder or body part. If we did prolozone, the first time we do it is $350 because we have to examine you and check you out. After that, it's $175 an injection. PRP is $800 by itself. What we're famous for is people coming in and doing the stem cell regenerative biologics, and that's $4,675. We have HSA, health savings accounts, cover that. We have interest-free financing. There's lots of ways to do it. Many people do this for under $200 a month. So for some people, that's not a big number. Other people, I get it. It is, and it's tough. This is not an inexpensive thing, but it's an investment in your life. And if you can get your life back and you can, start using that shoulder and, whatever it is you do, it's a pretty awesome thing. So what's next? If you call this number, 603-380-9159, and hit number 2, that goes directly to my cell phone. If you're watching this from a computer, there should be below a place where you can fill out your information, and we can schedule you for either a talk to talk to us or to schedule a consultation in our office. I hope this was super informative. Again, my name is Dr. Jeff Donatello. I'm at the clinic, or the Center for Wellbeing here in Portsmouth, New Hampshire. I hope to see you soon. Thank you.